If someone says heart attack, what image comes to your mind? Definitely एक typical सा picture हम सबके mind में आता है. You know, a man holding his chest, collapsing, sweating, right? But what if I tell you, in women, a heart attack might look like fatigue, nausea, or just even back pain. And that's exactly why so many cases get missed.
It's a male dominant society, so we do ignore females a little bit. So I won't be minding to say such words, but definitely we have to take care of the females and their heart as well, equal to what we are taking care of the men's nowadays.
I think most people believe कि heart to heart होता है, same ही होता है, male हो या female हो.
Female heart is definitely very different from what the male heart, but otherwise also the female whole structure is very different from the male. Talking about the female heart, definitely their heart is a little smaller in size. The heart walls are a little bit thinner when we are comparing it with the males. Then the arteries which are there in the female's heart, that coronaries we talk about, that is also a little smaller, more tortuous. It's very difficult to identify. Then the emotional status of the females. When we talk about male, they think from here. दिमाग से सोचते हैं. When we are talking about the females, they think more about from their heart.
As you mentioned, hormones. So hormones protect the heart. It is often called, a cardioprotective hormone, as you rightly mentioned. Is it reducing cholesterol levels, improving the blood flow, or what exactly it is?
Females of this generation, or women of this generation, I will not go very back in time when females were only managing a house and doing the chores of the house only. So nowadays, females are doing everything, every possible thing. They are driving vehicles. Nowadays, we are seeing these young generation or the youths of today. They enjoy smoking or taking alcohol. So when we are talking about the smoking and alcohol part as well, so in males, the development of heart risk, it comes at a very late period, or maybe they will consume cigarette or alcohol for say 5 or 10 years, then they will develop heart issues. But if the females, they are consuming it, they will develop heart diseases at a faster rate. Yeah. So at a very early age, they might get all these issues.
And as you said, during pregnancy also, postpartum, usually the focus shifts towards the child. And that is the time, a mother
should be taken care of.
Very true.
The typical symptoms that we are talking about, it is not very frequent with the females. Typical symptoms are not very frequently found in the females, but more commonly they'll be telling about back pain, jaw pain, sweating, and one symptom which comes very early in their period, or maybe when we talk about the angina or angina equivalent. So it's the nausea, and along with that, easy fatigability, that we are tired whole time. We are being like, we are not able to do things, or I don't want to work, I'm just feeling lazy or drowsy.
Career, home, kids, family expectations, and somewhere, their own health comes last.
Last.
Do lifestyle and stress affect women differently than men?